feedback from the patient for better operational aspect and also for early diagnostic need. And it helps us to shape up the strategy treatment plan. Today, there is a patient-centric approach, and we say it is a patient-centric world. So, healthcare delivery forms the foundation of the patient experience and its improvement, which helps for better hospitalization experience. So today, this panel discussion will both solve some of the questions which is asked that do a patient need better insurance? Do a patient need better discharge services or better post-surgical care? Or are we able to shorter the waiting period? Are we able to provide the clean toilet? So let us see how this sort of little bit questioning and the enrich and par are make us a safe healthcare journey. So let me introduce first. In this panel discussion, we have Dr. Saurabh, who is working as Assistant Medical Superintendent from Chhatrapati Shivaji Hospital, a parent hospital of Subharati Medical College, Meerut, which is 1100 bedded hospital, and Dr. Saurabh is from Preventive and Social Medicine. Our next panelist is Colonel Indira Das, who is working on post of Associate Professor in the Department of Mental Health Nursing from College of Nursing, Command Hospital, Lucknow. Our third panelist is Mrs. Lekha Saji, who is working as a teacher in a mission school and who was admitted in the hospital, Subharati Hospital, for her surgical condition. The fourth panelist is Mrs. Lindsay Abraham, who is working as a dual role in Chhatrapati Shivaji Hospital with the specialization of certified cardiac perfusionist, and she's also working as an assistant professor in College of Nursing, Subharati Nursing College. And my co-moderator is Professor Ambli, who is a ANI member from the Karnataka chapter and at present working as professor in Department of OBG Nursing in Subharati Nursing College, Meerut. So this is a small intro of a multidisciplinary healthcare team, which is valued mainly on patient core experience. So Dr. Saurabh, I welcome you all from my core of the heart. And I think since it is a panel discussion, so let us come with our first query to you that how do you feel that a patient need to be informed in advance about the hospital policy?
Okay, firstly, good morning to every one of you. I'm Dr. Saurabh Sharma. Thanks for the introduction, ma'am, and I'm very delighted to see the initiative ANEI stand for the patient beneficial approach. And this, I guess, I must share this thing after working the hospital setup in this big hospital since last 2 or 3 years. I came to know this is the most important thing. Your patient should be satisfied, should be the primary thing. Other things come secondarily. Now, coming to the question, ma'am has asked, uh, the, uh, the the patient should know in advance about the rules and regulations of the hospital. And believe me, this point is not only crucial for smooth operations or enhancing patient experience, but it is important for patient smooth compliance as well as medical legal aspects. Everywhere these days medical legal things are coming and patients are thinking there about their rights, they're knowing about the things they are getting in the hospital. So I will share you few things which we have done, few things which are happening around other hospitals, and things which I feel are best things in a society, in a community, in a developing country like India. So the first point, the most important thing and easiest thing to do for this case is on-site signage and information boards. What I have seen and what I have we have done in our hospital. Right from entrance, we have noted down what are the patient's rights and responsibilities, what they have to do. At the time of OPD registration, there are tariffs displayed there for various operations or various things happening in the hospital. And believe me, this is advised by NABH also. Other things are, there are many things where your facilities changes with time. For those things, digital screens are there. On digital screens, the things which vary every day or which vary in months, those things are displayed so that patient can see them easily. And I just want to emphasize a point here that it should be in the bilingual language. One is English, second is should the vernacular language of that place, because we have seen most of the patients they are comfortable with their own language. Second thing is printed material at key locations. Key locations means where they are entering, like OT. Although we have displayed so many things at OPD counter or in their wards, but OT is a place where you display these things. Dialysis points. So these are the places. There are many other places also where we can display our rules and regulations so that patient can easily read them. If I say other things is as technology has come out with so many things, these days interactive kiosks are also available. Now we have also made it available in our setup, and we are trying to do it more for registration also, for asking their queries also, to guide a way also into the hospital. Depending on the capacity of the hospital or the other things, we can have verbal communication with the patients. We could have a team of people, public relationship officers who can interact with patients and tell them about different things what they want to ask. Am I audible? Can
Yeah, yeah,
anyone
yeah.
confirm? I guess. Okay,
Yes,
okay.
yes, yes.
So depending on the strength of the hospital, but I believe this is the best thing we can, deputing a person there, public relationship officer there, because even if you display something, a person, a beneficiary may understood in a different way. The perception may be different, the understanding may be different. So verbal communication in language with a person, it solves most of the problems. But it takes manpower, so it increases your expenditure also. But believe me, patient satisfaction about the rules and regulation we have seen best in this. Other thing, again, technology has evolved. Hospital website, hospital have their web these days, so we can ensure to provide all the information. Or the best thing to do these days, providing FAQs of the facilities, about the charges, about roles and responsibilities on their website. Now with development hospital information system, everyone has to develop this HIS in their hospital. Now, one more option has developed, the option of providing in-phone apps to the patient. These apps are very much useful. From these apps, a person can register himself. He can see other things, see the facilities. He can book the appointment, see the timing, see the tariffs. All the things can be done through these apps, and these apps are connected with HIS, so the person can see the reports and every other things on these things. In providing emails or the text messages, many hospital has done. Whenever you stay in hospital, you get a message on your phone. When you book something, you book test, you get a message on your phone. What about the bills and other things? Apart from that, flyers, brochures, these things can be provided. Although these days, what everyone is doing and we are doing is we are providing these things in soft copies, because using so much papers, again, your environment also, and people these days are, everyone, almost everyone is having smartphone. So we are trying to put it the people also. And as we are seeing in this group of nurses, I would believe the staff training on this point is very important. We regularly do this thing. The staff should be oriented about facilities we are providing, and specifically in the area the staff is posted. He should know in out of everything, the timing of the procedure, the necessities of the procedure, the prerequisite, the payment part, and every other thing. Staff training is again very important. And apart from that, we also have files prepared for the patient, which we say these are information packets. Especially we are using these things, PET scan areas where you have to come with a few preparations. When you come for PET scan, you come for MRI. So all these things we are providing to the people, or we can do these things in areas to get orientation about the rules and regulations of the hospital. Ma'am, anything you want to add from my side? These are things.
Thank you so much, Dr. Saurabh. And the most important thing you have told about that all the information you have done on bilingual, which is the very, I feel, the emotional point you have taken it. And second thing you have mentioned about that you were given the emphasis on the critical area where we find not only patient, their relatives are there with lot of apprehension. Thank you so much for giving the complete information about me. Let me go to the second panelist, Colonel Indira Das, who is from the Army establishment. That how do they think that their hospital policies are related to the patient safety? Colonel Indira?
Thank you, ma'am. Good afternoon, ma'am. First of all, when you think of patient safety, people generally tend to think it is a physical or physiological thing, and we tend to ignore normally the psychological and financial aspect of it. When we think of a safe patient, we need to ensure all these dimensions of health, I guess. So we have patient care policies, of course, and when it goes for patient care policies, there is no one size fits all. So depending on the services you are providing, the area you are working, so we'll have different patient care policies, something for intensive care and some areas like mental health. So depending on that, you'll have to cater. Second is the hospital infection control committee, which like policies which every hospital has. So we are also following a strict adherence to the hospital infection control, the periodic routine checkup of the area, the swabs and the cultures, and the report is being generated and it is being presented in front of the whole hospital so that there is a clarity of the state we are in. Course, we have these emergency management policies, code blue, code red, code green, code gray for the violent patient. So we have certain emergency management, then standard treatment policies so that there is a standardization of management and antibiotic policies, of course, and information security. Now, I guess that point has become very pertinent these days. So you won't be finding, ma'am, any one of us in Facebook or any other social media platform because we are very sensitive and we in fact maintain a record of this information security. So no information related to patients and all documents of patients are treated in a confidential manner. So that is one patient safety issue, I guess, because there is no invasion of privacy and divulging of information unnecessary for this matter. And of course, drug handling is a very crucial area. And we have drug handling policies for the LASA drugs, those tall man littering. In fact, we have color coding systems to avoid any near miss or any errors. And then the documentation part of it, the drug administration, everything is so based on the policy and it is periodically checked by the supervisor. So there is no, we try to maintain a zero error in that area. Plus, in my department, we have narcotic drugs. So we are following that double lock system. So it is always kept under double lock and the two keys are with two different persons following the guidelines. Then control drug registers, etc. we are maintaining. So drug handling policy is very strictly followed. Then we have blood storage policy based on the NABH guidelines. We have the fall prevention restraint policy we are practicing, especially in mental health. We are going by the Mental Health Act of 2017 and we are ensuring that no patient is being injured anyhow by our restraining policy. We have fire safety. We have national disaster management policy based on Apada Mitra of Government of India. Then we have seismic safety. We structure and maintain the things so that any case of earthquake, the minimal damage takes place and the patient passage takes place accordingly. Then electrical equipment safety practices, again, the National Federation of Engineers guidelines are followed. Every department has a copy of that and it is disseminated periodically. Lectures are taken, sensitization is done, not only for the nursing profession, it is for our grassroots level workers, housekeepers, everyone is made aware of those policies, firefighting policies in a language they understand. And of course, we have biomedical management policy, we have a biomedical waste management plan, and we are adhering to all the government guidelines. Then, of course, we have SOPs, policies for the job descriptions. Like we want to avoid the overlapping of roles between nurses, doctors, and paramedicals, and who is supposed to do what. That is also charted and disseminated to all our respected people. Then, patient safety related policies, ma'am, that we have. Apart from that, as I said, the psychological area, we have a code of ethics as well, which looks after the patient's rights and responsibilities, which sir has already mentioned. And we conduct something called patient's darbar, in which patients are sensitized about their rights and any grievances, anything that is immediately addressed by the senior most people. And the regular rounds by the supervisor is also part of the policy. Like nothing goes unnoticed by the authority. So related to patient safety, ma'am, these all policies we are very religiously following, ma'am. Yes, ma'am.
Thank you, Colonel Indra. You have started with the physical infrastructure safety to the safety, digital safety, like you have mentioned about the information security, and coming up to the drug handling with your, especially you have mentioned about the narcotic safe handling drugs. So
Yes.
I think you have covered all the aspects that to have to achieve the common aim of to prevent harm. That's which is what is a main theme of our panel discussion. Thank you so much. And now let us move to our third panelist, who is, I have been mentioning from that she is a very valuable, we say customer, or she is a valuable person in today's Empire our show. Yes, I welcome Mrs. Lekha to come. Namaskar and greetings to you first. And I would like to request you to kindly narrate your hospitalization experience, so that today here we have participants from all over India, I must say, and they are eager to hear you. So over to Mrs. Lekha ji.
Good afternoon, everyone. First of all, I would like to extend my sincere gratitude to the organizers to provide me an opportunity to speak on this platform. I feel so honored and delighted to speak here. Actually, my experience as a patient in Subharadhi Hospital was quite satisfactory. I was admitted there with severe abdominal pain and high sugar level. It was diagnosed that a gallstone stuck in my CBD, and they advised ERCP for that. As the pain subsided, I got discharged after 2 days with an advice of follow-up and all. And these days, I got a very satisfactory treatment under Dr. Sirobi Sharma. The entire team was very cooperative. They all treated me very well. I observed that all the staff members are very sincere there. They are hardworking. I felt so happy and contented for their treatment in Subharadhi.
I'll just come up with you with my second question, that how you find the best way for the patient to be informed regarding the rules and regulation of the hospital. As you must have heard now, Dr. Saurabh and Colonel Indira has mentioned about some of the policy related to their working field. Mrs. Lekha?
Yes, ma'am. Actually, I feel that the rules and regulations of the hospital should be conveyed prior to the treatment with vocal conversation in the mother tongue of the patient, with utmost concern and in a very polite manner. I feel that the patients must be in a very frustrated or in a very stressful period and stressful, and they must be so anxious about their condition also. So if the treatment is in this way, by conveying the rules and regulations in a very concerned manner, it will be much more fruitful than convincing it in very formal way.
Okay. So, your first point you have mentioned that it has to be in their own language, the information to be
Yes,
said.
ma'am. Yes, ma'am. Yes, ma'am.
Or how you feel that the information is good or safe or informative in the form of a soft, like in the form of the digital.
Yes, ma'am. I feel digital way of conveyance may not be so much fruitful for everyone, because
Okay.
the patients may come from different areas. So everybody cannot understand all these things in a digital manner. But with conversation in their own language, in their local language, it will be much more fruitful. This is what I feel.
Thank you. Now, Dr. Saurabh, are you there?
Yes, ma'am, I'm here.
Yeah. Yes, there is a second. I just want to have a query with you that how do you feel today that there is so much of advancement in the health system, and how it is beneficial for the patient and their family members?
Yes, ma'am.
Okay,
Actually,
got it, ma'am.
advancement in the
Dr.
advanced.
Saurabh, yeah, ma'am, Lekha, I have just come to the Dr. Saurabh now, and then I'll come back to you.
Okay, ma'am. Okay, all right.
No, before answering your question, let me tell you, Lekha ma'am, taken your feedback and we'll work on it. That the main thing is the most point is counseling a patient in his or her own way, in an empathetic way, in a non-judgmental way. We personally taken this point, and for most of the patient, we will apply this, ma'am. Thanks for the feedback, ma'am. And
Okay, sir.
coming to the question, ma'am, what you have asked is what are benefits of advancement in health system? Madam, believe me, I say to all my fellow medicos and medical students that medical science these days, most of the medical science is based on engineers. We must thank our engineer friends for all the things they are providing. Many things as a doctor also patient don't see what is happening around, but I'll say about few points which a common person can also understand that what is the contribution of the advancement in health system. One of the most important thing which is added in health system after COVID-19 is telemedicine. Telemedicine is something for which guidelines were laid down
You have muted, yeah.
Getting benefit from this. Audible? Am I audible?
Yeah.
okay okay fine. Many patients are getting benefit of it. Uh, there are patients of diabetes. Let me give an example. There are patients of diabetes who come for treatment, and they come once in a month or once. But in the meantime, they send their blood sugar level to their doctors, and they advise any change in the dose of insulin to them. This is a perfect example of getting benefit of this telemedicine. Before that, I have seen patients, whatever doctor have said to them, they were using it, and when patient comes after 2 or 3 months, diabetes was out of control, and then we understood what was the problem. Same concept now these days. Even we are working in ICU care. Now there is concept of tele ICUs. Now we are not exactly using tele ICUs, but this is the hybrid model. What we have done, we have put some high resolution cameras from every angle in the ICU. Plus, we have control. We have access of all the monitors on the telephones or on the mobile phones of consultant. Anytime they can see the monitors, they can see from the camera. They have access of the camera. They can also rotate the camera to see the patient itself. The camera are so much good. You can even look at the eyes of the patient. So this is thing which we have applied, and it was from the experience of COVID-19 that all the time, 24 hours, a consultant can see the patient, whatever time it is. Believe me, the recovery rate, the rate of recovery has improved after that. Second point after you say advancement is now we have something called precision medicine. Earlier it was like patient is having something, you provide drug, he will be cured or not cured. But after technology, we have precision medicine. You give drugs precisely. There are molecular analysis. There are drug sensitivity tests which are done in mind. So precision medicine is provided to the patient, and it includes molecular diagnostic, genetic diagnostics, everything. Apart from that, advanced diagnostics are there. PET scan, CT scan is gone. These, but PET scan is something. Gamma camera is something we are using. Apart from that, what I believe is, in fact, government has also started using it. They are promoting a ID for the patient, Aadhaar based health ID. And now, because of these advancements, every patient would have his or her digital health record from day one of your admission, or your from the date of delivery of a child till the age of 50, 60, 70 years. He would be having all the digital contacts of him or her. He would be able to see his contact himself. Wherever he will go, he will provide his ABA ID. The doctor would be able to see all the records. So the his taking part would be very easy in that case. And patient specific portals are also there, in which patient can go to a portal. He can see the things. He see the treatment aid which is given to us, given to that patient. Plus, there are so many things you people must be using it. There are so many health apps. There are so many wearables which we are using. We are monitoring our heart rate. Even there was a case when the wristwatch, the Apple wristwatch, has detected MI in a very earlier stage. So these wearables are very important, especially in the case of diabetes, in the case of asthma, where you have to measure continuous, you know, continuous monitoring of blood glucose and gases. These app things are important. Plus, reading materials are also there. And what I have seen, I'll share an example. I went to Kedarnath and uh, just visited few villages nearby. Being a public health professional, like people, I ask so many things. Yeah, how you are getting services, how you are taking care of your disease, and people there were connected to their health centers through their telephone, through smartphones. They were getting appointments from that, they were getting treatment from that also. And it was happening in those hilly areas. That was very delighted to see that thing. And one thing I want to stress is from this health, I'm specifically talking about the health system, madam, about advancement in health system. One thing which it came out these days is online support communities. And I'll quote you an example of this. I won't take the name. There's a doctor friend of mine whose only child was having autism. Both of parents are doctors. And believe, because of those challenges, even doctor friends, they were thinking, they were having suicidal thought. They said, we cannot see in the future what happened in the future. We see total darkness into the futures of this thing. Why we are living, why we are running, what would happen to a child after us. So after the introduction of few online support communities, they engage with the people who were managing all these things with since so many years. They got an idea how to manage the child, how to manage themselves. and how to manage finances also for the future. What are the different organizations which can work for? So this was something which was missing in our earlier clinical tests. We were not having these things. And because of transparency in the system, because of digitalization of records, because of digitalization of all the health FSCs, these days the preventive health is helping them. The transparency in the financial system, it is helping a lot. Patient, whatever bill they are getting how much GST they are paying, what the test for which that particular thing was implied. So the repercussions on their bill satisfaction, the facilities they are getting, the expenses they are putting on behalf of it, and all as well emotional support, family support, everything is connected. Everything is connected. And being a doctor, I must thank all the engineers, all the people who are working hard to make this possible. So this was from my side, ma'am. Anything from side?
Thank you so much, Dr. Saurabh. The main focus was the digitalization and transparencies in the financial cost for the patient is the main point which has come out of your this thing. Now, Colonel Indra, are you there?
Yes, ma'am. Yes, ma'am.
Yeah. Yeah, I just want to narrate that as per your perspective, what improvement you can talk about in nursing service for the better patient care?
Yes, ma'am. Nursing service, if we talk of improvement, first thing I'll take the patient care only. Patient care is an ongoing process. The way medical system is getting complex day by day, so we can never achieve the perfection in nursing care, and we'll have to make a daily effort, and daily we'll have to make some changes, and we'll have to make improvements. Like we cannot sit at a point and we can say we have improved. So patient care is the first area where I would say we need to improve, and we need to continue to that improvement. Second is, I think as nurses, we need to improve our critical thinking area. There are recently I interacted with few, and they told, I asked how to give that particular medicine. They told me, as the doctor advised, we will administer. That was in our practical exam. So the thing is, critical thinking part, I think we need to inculcate more of that in our nurses so that they can identify the signs of any deviation from normal in the patient at the earliest, and they can take a clinical decision within their jurisdiction. They can do the reporting promptly. For that, they need to be very vigilant, and they have to give attention to every detail of the patient. They should have a non-judgmental, open-minded attitude. And a few days back in one of the session, I was observing Madam Thangam told it should be like you should be a why baby. You should ask a why for everything. I think that area we need to make an improvement. We should have that inquisitive mind, and following the channel of communication, we should always ask why this drug, why this side effect, why this patient, why this, why that. So that critical thinking area, I think we need to improve upon. Next is the clarity of job description. Sometimes there is overlapping duties of the doctors and nurses, or between the nurses and paramedicals. So that actually takes away the non-technical task, might take away the actual direct nursing care time from the nurses. So if we be very specific and we adhere to the job description part, maybe we will be able to deliver better nursing care. We'll have more time, and we'll focus on only what is pertaining to quality nursing care rather than the non-technical overlapping things. Next is we should have more knowledge, I guess, on the ethical part and legal part, like what is taught, what is false imprisonment. Sometimes unknowingly we do certain, like restraining a patient, which is actually illegal and put us in trouble. So I think nurses needs to be more sensitized about the legal and ethical issues to safeguard themselves and to deliver a better, safe care to the patient. Then, of course, time management is one area. One who mastered the time, I think it will be very easy and efficient, effective nursing care can be delivered if we manage time well. Assertiveness is one area nurses need to improve. I think many of the nurses lack assertiveness. They need to be encouraged and taught how to put up their point in a very pertinent and polite manner at the same time, and how to not to reject a person and but to put up their point of view as well when something is getting more than what they could do. So assertiveness is one area nurses must improve. Communication skills, of course. Sometimes in transcultural nursing, the language can be a barrier. So I think basic communication should be, nurses have a scope for improvement. Then, of course, the technology. Now, as sir also mentioned, the AI is taking over quite something, and the hospital information system also has become digitalized. So, basic one training or one awareness about the technological part, every nurses should have. That is mandatory, and we can still improve because many of us may not be as pro. Again, leadership. Now, leadership is not always comes with your position. You have to earn it through your action, I guess, like your involvement, your initiatives, the innovation you take, your lateral thinking, your resilience, then your human qualities beyond your actual competence, professional competence. These are many things which makes you a leader. So I think nurses must improve their leadership skills, and in that area, I think scope of improvement is there. Plus, decision making and policy making, of course. Like nursing is nothing that you get an instruction and you simply carry out. No, it is much beyond that. We have a separate body of knowledge. We have evidence-based practice. We have nursing research. So we must get involved in some sort of policy making, which is beneficiary for nurses, or maybe the hospital policy. So that area, many places, nurses are not made a part of the policy making and decision making. So I think that involvement is needed. Plus, staff shortage, again, of course, we can improve because as per the 2022 December report of Ministry of Health and Welfare, there also we are only 80% available, like it is 1:476 population. So again, there is a scope for improvement in staff shortage. The moment the shortage is covered, the quality of care will automatically be followed. Then higher education. Now, when I say higher education, these days there is mushrooming of colleges. Everybody is getting the degree, but the standard of training somewhere is getting diluted also. So we need to have standardized policies to see, and regulatory bodies to see the training is standardized. And wages can improve, definitely, because the starting salary of a nurse starts with somewhere around 10,000 to 15,000 even today. So wages can improve, welfare measures can improve, and of course, the status part, of course, because the media portrayal of also is not very satisfactory. The public image also needs to improve. So I guess as an organization, as a team effort and an individual effort, every area we have some scope for, though we have come a long, long way, but we still have some areas to explore and improve. Thank you.
Thank you. So you have completely covered all the domains, cognitive, psychomotor, and the affective domain for a nursing personnel to
Yeah.
come up with the aim to prevent harm for the patient. Thank you. Yes, Mrs. Lekhaji, now I would like to ask that what are your expectations and recommendation to achieve better quality care in as IPD patient?
Yes, ma'am. Am I audible?
Yes, yes.
Yes. Ma'am, I expect a kind, considerate, and compassionate atmosphere for the patients, just as I already told earlier.
Yes.
Actually, patients should be listened, and the patient should be informed well about their conditions, and the instruction should be very clear to them. And if they rely on the doctors and the medicines that are providing to them, 50% of they will be cured. 50% of their condition will improve. And that's why kindness and compassionate behavior is very, very important, ma'am. That is what I feel.
Okay.
Thank you.
So you wanted, as per your comment, good ambience and
Good ambience.
trustful
Yes,
care.
ma'am.
Yes.
Yes,
Okay.
ma'am. Patient care should be in a very compassionate way.
Dr. Saurabh. Dr. Saurabh.
Yes, ma'am.
Yes, yes.
Ma'am.
uh, I just want to ask the last few questions, two questions first. That how do you feel as a doctor? The patient response are helpful in providing quality care in hospital. I think you have
Yes,
mentioned
ma'am. So
some of the points, but again, to summarize.
it's a vital component. And ma'am, Rekha, ma'am, you are an ideal patient. The way you have provided the things that these things should be there in a doctor environment, you have it so simple, and I got every point you have said. I've write it down on my paper. That are the most important. Whatever we are providing, what are the important things a patient want to know, want to get from us. So, thank you, ma'am. Thanks every word you have said. It's a marvelous, and we'll be using your feedback properly. And coming to your question, ma'am, again, now patient feedback is everything for the hospital. I believe, being AMS, being a medical superintendent in the hospital, most of the patient comes to me with their queries. And let me tell you what are their common queries. In their words, in Hindi, what they tell us. डॉक्टर साहब आपके यहाँ इसमें ओपीडी की लाइन में इतनी भीड़ है भाई, हम तो आके परेशान हो गए, कहीं और दिखा लेंगे, इतनी लंबी लाइन में नहीं लग सकते हम. सेकेंड थिंग दे सेड, पता ही नहीं चलता कौन सी चीज वहां पर है. ये हार्ट वाली होगी, बता दी, वहां जाओ वो तो मिली ही नहीं. हम तो कई बार उसके सामने से निकल गए, पता ही नहीं चला वो हार्ट वाली ओपीडी है. अदर थिंग्स दे से आपके यहाँ पैसों का पता ही नहीं चला जी, कितने पैसे लगे. हम तो हमें बताया 1100 रुपए कराने गए, इट वॉज मोर देन 1100. अदर थिंग्स, डॉक्टर साहब ने हमें कुछ बताया दो, बट हमें समझ नहीं आया. नहीं, वो दोबारा बताया, दोबारा समझ नहीं आया, मुझे नहीं पता कि क्या करना है. डॉक्टर साहब ये बता दो हमें, पता ही नहीं चल रहा हमारे मरीज का हाल क्या है. अदर थिंग दे से डॉक्टर भी अच्छे हैं, इलाज भी ठीक है, बट नर्सिंग स्टाफ ना ठीक से बात करता, वो केयर नहीं करता. अपार्ट फ्रॉम जी आपके यहाँ सब अच्छा है, पर मेरे बेड के ऊपर पंखा नहीं है. मैं तो इस बात से परेशान हूँ, बेड के ऊपर पंखा है, मेरे यहाँ पे पंखा नहीं. किसी को कॉकरोच दिखते हैं, किसी को लगता है कि रात को हम यहाँ रुके, डॉक्टर साहब रात को भूख लगी हमें, तो पेशेंट के लिए तो आपने दे दिया था, हमें भूख लगी तो हमारे खाने के लिए कुछ था ही नहीं, आपको कैंटीन खुलवानी चाहिए. No, there are so many. These are just few things I have paid to you, but there are so many things people say us, and many a times I still think what to answer them. There are many queries which are like, डॉक्टर साहब डायलिसिस में इतना टाइम क्यों लगता है, डायलिसिस जल्दी क्यों नहीं हो जाता है, घंटे में क्यों नहीं हो जाता. You cannot answer it. The time taken by dialysis is that much. Sometimes even in dialysis patient, you ask the patient to come with appointment so that they don't have to wait for so long. But a patient who is inside gets complicated. 30 minutes or 1 hour may be extra taken in that patient, and they have to wait for one more extra hour. Again they come to us कि डॉक्टर साहब हमारे टाइम की कोई वैल्यू नहीं है, आपने बुला लिया है, क्या कर रहे. So many a times I believe most of things a patient say, it can be solved by counseling itself. And second thing, from their feedback, if we take their feedback, we can improve the system. The specific word for this, we can improve the gaps. We are service providers. The gaps by the doctor, by the nursing staff, by the hospital administration, these gaps can be identified. These gaps can be fulfilled later. Second thing is their experience into the hospital. Not saying everything, every time a patient would be complaining to you what time lag gaya, ye problem. But what is their overall experience? If everything went fine, even after that, the overall experience not be good. Believe me, There are patients who came to us, they said the parking is this at a distance from your hospital. Everything was fine in the hospital, but the parking for a vehicle was at a distance. So it's a problem for us. So even if you provide all the things, you get an idea. There are different other things which we have to manage. Looking at the different problems set by different patient, looking at their status, their complaints. What I believe is we should design customized care plans for patients. There are patients who want air conditions, but they don't have money to pay. Now, look at the weather these days. The temperature is almost 46, 47 degrees centigrade. And if you look at the general ward, which don't have air condition, a patient cannot stay. Even a patient from village cannot stay because in village he is getting a much better environment than which providing in general ward. So we have to customize our care plans. We can provide air conditioner. We can increase fee in a nominal way, and we can sell them that you will get benefit from this. Second thing is every client a patient is giving to you or providing to you, you're getting an opportunity to communicate to that person. Increased communication with patient, increased communication with beneficiary will improve the health services always. It will improve the operational efficiency. It will improve the process improvements. And believe me, a terminology we always use in our in a hospital is workforce optimization. There are
Correct.
places where you need more number of staff. There are places lesser number of staff will do. So and with it the feedback comes from the patients कि यार यहाँ पे डॉक्टर साहब कम पड़ रहा है हमको. हमने बोला कि हमें डायपर चेंज है, क्लास और कोई था नहीं, 2 घंटे लग गए, 3 घंटे लग गए. तो नीचे ने आइडिया कि यार कितने पेशेंट हैं आपके यहाँ, हाउ मेनी पेशेंट्स यू हैव, how much you need out of this. So it is important for us. Other point which I must stress out is staff training development. The training in our setup is a continuous process. Being a teaching institute, we have regular classes for nursing staff, but at times we get an idea what is lacking. Is the communication lacking, or is it skill lacking, or number of staff is lacking? How can we overcome this? This is very important, and it's not about the deficiency only. It's again appreciating the person who is doing better. Who is doing
Correct.
better? You get feedback of that person also. यार ये तो डॉक्टर साहब आपके यहाँ ये जो नर्सिंग स्टाफ थे ना, इन्होंने दिल जीत लिया. Many a time people say कि मुझे ना उनके वार्ड में जाना है. They don't say the name of doctor. There's a name of nursing staff कि उनके वार्ड में जाना है. वो वहाँ वहाँ मेरे को बड़ा अच्छा है. वो बात भी अच्छे से करते हैं. मैं whatever problem I face, he or she provides solution for that. So importance in that thing. Then safety and quality of care. There are examples from our hospital. A patient came to me. He said, Doctor Sahab, the railing is broken in a specific area. I had a 3 year old child with me, and अगर को नहीं पकड़ता तो वो वहां गिर जाता. I visited that area. This was a small 2 feet gap. I ignored that, and after that they get complaint कि यार this is important feedback for us. Immediately we went for the taping, and very next day we covered it properly. So these are the things which are the part of quality we are providing to the patient. The safety of the patient. These days, a lot of stress is on the safety of patient. Government of India is also stressing on this particular thing. Then strengthening the relationship of trust. You listen, as Madam said, Lekha Madam said, you should listen the patient properly, and not only complaints, not only the health issues, but the complaints a patient is providing to us. We should listen those complaints properly because a lot of things are hidden in that thing. We we if we take our rounds daily, we may ignore those things, but the patient will provide, Doctor Saab, this is lacking in your area. And believe me, the last point I would say is our innovation depends on the problems you are giving to us. You say this is the problem, we would innovate on it. If you did say there is no problem, the innovation will add. So your feedback, your questions to us, they help us to improve too much in our quality, in our services, and the satisfaction of the patients. This was from my side,
Thank,
ma'am.
thank you, Dr. Saab. One more point. This is from the audience also we got that how you find the proper documentation, digital recorded are helping in quality care.
Ma'am, okay. So this is a question from your side. The question is, I guess digital, how it is, how we are getting benefit from records,
Proper documentation. Benefit
documentation.
of
Okay, ma'am. Okay. Believe me, being a person of community medicine, and I have served in WHO for 2 years, and I learned from that particular organization that documentation is everything. Because WHO is an organization who does surveys. Data is the final verdict of anything in any part of world. So they told us that whatever you do it with documentation and do it with proper methodology. And when I came to the hospital and I at the MRD department, I realized the same thing. So first thing I would say is it helps in a proper decision making, because whenever we analyze our records, what we see usually, we see what is the bed occupancy in hospital. Okay, what is average duration of discharge in our hospital? What are the antibiotics frequently used in our hospital? Are those antibiotics used in accordance of antibiotic policy? What is the rate of hospital-acquired infection? What is readmission rate? So these are few things which we get from records, and that helps improvement of quality. We are using proper antibiotics. Patient का stay बहुत लंबा तो नहीं हो गया. Suppose a typhoid patient, the average time is 6 days. He should get discharged in 6 days, and in our hospital we are seeing the patient is residing for 10 days. We get an idea, यार हम कुछ गलत तो नहीं कर रहे. What is happening in our patients is these are the things we realize, we learn from our records. And because of these things, there is lot of error reduction. And errors, many a times we have to find it. And a medical audit is a process. Fortnightly, have a meeting, we look at our records. There is a team of doctors, and that team is always changed according to a specialty. We pick a case randomly, mostly from the ICU. We do the audit. The audit involves right from the information of the patient to the treatment given to the patient, appropriate treatment was given to the patient, to the discharge of the patient, to the discharge summary of the patient. We look at each and every point, and that is possible because the record we are having is of good quality. If the record we don't have of good quality, we would having so much problems. Now adding to it the digitalization part, the digitalization part improves. What is the improvement with digitalization? One thing is the errors are less, the misinterpretations are less. मैंने अपनी writing में लिखा, मेरी writing किसी को समझ नहीं आई, मैंने कुछ और दे दिया, कुछ और कर दिया. These are usual problems which happen. If the record is digitalized, we'll get a real-time record. I get a report of CBC today. It is on the record of the patient that these are the findings of CBC. Please change your treatment. These are findings of KFT. Change your treatment. So digitalization helps us a lot. Apart from that, tracking and monitoring the other things, a patient, how we have planned to provide a discharge summary. In a discharge, we have we are planning to make columns from day 1 to day last. What the test done with the patient? A comparative of all this will be provided. Day 1, आपका CBC इतना था, आपका KFT इतना था, आपका LFT इतना था. Then this was the improvement, and it would be provided in a tabular way so that patient also see it. A doctor can see it. And if the patient further get admitted to the hospital, we get an idea. This happened to the patient. Patient responded with this antibiotic, and we work like this. And the most important thing is we get so many people from the police department coming to our hospital and to any hospital, I would say, because of legal thing. Now, legal compliance is very important. So many TPA patients are there we are catering. So many MLC patients we are looking these days. Medical records we are bound to maintain, and these medical on basis of these medical records, court also provide their, verdict. So these medical, records not only help you, it helps the court also. और कोई सही है, गलत है, मुलजिम है, नहीं है, आपका medical record decide करता है. So digitalization again help to get appropriate medical records, and they can benefit out of this. Efficient resource management is again there. We can understand कौन से वार्ड में ज्यादा admission हो रहे हैं, in what admissions are less. We can, use our manpower according to the rate of patients coming to the particular thing. So again the same word, workforce optimization or efficient resource management. These things can be done according to the medical records. And believe me, a very simple thing, we maintain pharmacy also. As people maintain their pharmacy, how will they get an idea which medicine they have to keep milk or which medicine is used least? This is from medical, nothing else. And this is a group of, I guess, education is admissions. Research is something which is not possible without medical knowledge. We learned something about it. Case control studies, we learned some cross-sectional studies. So everything, these things, when you retrospective in your research, you need medical records, nothing else. And even the policies made, which are policies which were made by government based on medical records. Earlier in our times, we used to say, if you have more than 3 weeks, you should get checked for tuberculosis. These days, it is 2 weeks. Our government has realized that it is the 3 weeks was much more. To make it to 2 weeks. This is from medical record, nothing else. This is quality of healthcare. If you are improving every day, you are improving your quality. Apart from that, we are maintaining your data. If you come and to come to hospital and ask what was the, please provide the discharge summary. Please provide the treatment summary, and I am providing in a particular good format to you. You will understand what was the things provided to you. The communication, the relation between us and you will increase. Even the patient will get trust to us. They provided us the treatment and they have documented each and everything. There is no cheating in this. And
Thank you so much, Dr. Saurabh.
my
The emotionally practical points you're discussing, and there are so many questions from the audience. I think I'll email you because next
okay, ma'am.
panelist is waiting. They have almost we have received 4 questions from the audience. I feel I don't know.
Okay,
They wanted to know about some new applications in the area of digitalization of records, some biomedical devices, how we can help in patient care. I think I'll just all the questions sent to you in email, and we will solve there because lot of
definitely. I would
and
be happy to answer everything, ma'am. It's ending for me also.
yes, yes, we need more series of Enpara because all team members are there to pour their points, how to have what to say, a better quality care. Yes. Mrs. Indra, Mrs. Indra, I just want to you mention you within 2 minutes that how you find the importance of shift duty for nurses. Yes.
Ma'am, shift duty for nurses within 2 minutes. Shift duties is actually very much. It is. There are three main advantage. Shift duty, like if you mean to say that we distribute in then 8 to 10 hours of shifts, like during COVID also we had certain this thing. So there are three main advantages. First is when the handing over is taking place, the debriefing is taking place. I guess there is the mental model between two nurses gets shared, which is very beneficial from patient safety point of view. Because if I am seeing a patient and I have a particular planning for this patient, a nursing care goals I have established. And when I have reviewed certain risk in that patient, and when I'm handing over in the shift duties, that same continuation of planning can take place. From patient's point of view, the mental model gets shared. Secondly, the reliability of the inputs, I guess, when handing over, taking over, from yes. So the handing over, taking over, we can get the feedback from both the sides. I think that will be very beneficial because later, if there is a bias of recall or something, or some action has to be taken. So during the change of shift, I think from patient safety point of view, it is very reliable to that kind. And third is the closed loop communication. When one nurse is handing over to another nurse, there is a closed loop communication. Like I can ensure whom the next shift I'm handing over, whatever I'm giving, the same inputs that particular person is also receiving and she's giving me the feedback. So again, I think communication errors can be minimized. That is from the patient's point of view. From the nursing officer's point of view, I guess if a particular person is acquainted to the particular shift, I think she has better orientation to the activities during that particular shift, and the work efficiency and effectiveness increases since there is a time limit and I know what all I'm supposed to do. I can make my objectives, I can prioritize my stuff, and handing over, I think the continuation of care part is shift duty remains useful, ma'am.
Okay, thank you. We have one more panelist here, Mrs. Lindsay. So, my question to you that how as cardiac perfusionist you find that you can provide better care, keeping in view to prevent patient harm, especially in critical care setting. Mrs. Lindsay,
Yes,
please.
thank you so much, ma'am. Thank you so much, ma'am. Good afternoon to all the panelists. So it's a great privilege for me to be designated as a cardiac perfusionist. Being perfusionist being the vital member of the cardiovascular team. So it's our responsibility to avoid the unnecessary incidents, which can be created during the cardiovascular surgery, and this can be having an adverse patient outcomes as well. So there are some things which normally has been a procedure which we are doing. Like there is before the procedures, the checklist is being used to see all the incidents which probably can take place. Like I want to list some of them. Like malfunctioning or defective equipments and supplies can be there. Like the machine which we are using for this perfusion. So there can be, that should be the battery backup should be seen, hand crank should be seen, and whether the machine is in a working condition, the pump which is there, that is in a working condition, that should be seen. And of course, the cannulas which are used for the surgery, that should also be priorly set up accordingly. Then on the basis of communication. So communication is a very important thing. If there is any failure of communication between the healthcare professionals or the healthcare team who are in that cardiovascular surgical team. So if there is any communication problem, it is also causing patient harm. So improper communication or in like complete information you're not giving. So that is also one point which should be seen in order to prevent harm and provide a good care for the patient. The third one is human error, of course, and if there is any incorrect execution of the procedure. So the person who is doing the procedure should be trained enough so that there is no incident or harm being happened in between. And if so, he or she should be able to manage that situation as well. So there are many situations which happens normally. So like in the checklist, free checklist, we call it. So for patient related, that is a normal thing which all of us are doing. So identification of the patient according to the ID numbers and all, consent and all is a very important aspect regarding the patient. So other than this, basically this machine perfusion is having that machine. So that machine working condition and provision of all the emergency equipment should be there. And the equipments or supplies which are used, that should be seen.
My last question to Mrs. Lekha ji, that just in 1 minute, I would like you to summarize and conclude this panel discussion, that how you find as a patient to be there in like this NFR in our India, like this is a new initiative. So how you find that this should be continued, or uh, this should be taken forward? So your view, please.
Yes, ma'am. I feel this initiative is really very appreciable because in every field, especially in medical field, empowerment is very, very important. Because new information will be carried forward from the different parts, different organizations or doctors towards the nursing faculties, and it really helps to improve the condition of the hospitals and means faculties. This is what I feel, ma'am. Am I clear?
Thank
Am I
you.
clear,
Thank you
ma'am?
so much. Yes, yes, yes. Thank you so much. We have one more query. Colonel Malti Rao is there. Colonel Malti Rao as a participant.
Yes,
Jai Hind to you, ma'am. You wanted to ask something since all the panelists are there. So you can ask your query.
my query was we have not done adequate intervention performances for safety of the patient where mechanical devices are concerned, because quite a lot of equipments which cause a lot of strain on the nurse are quite expensive. So any new devices are being planned or in the move, or anyone has done any studies which can help in making nursing care more easy for the.
Okay, so ma'am is Dr. Saurabh. I think ma'am is on AI part, artificial intelligence software for that. Can you answer madam's query?
What I'm getting from my question is what we are doing for the patient safe part when machines are being used.
Which is easy for nursing, nursing
Yes, ma'am.
professional.
Yes, what I believe is for what we are doing is, in fact, whenever we get an equipment, we get it from a good company with all the specification known to us. Our biomedical engineer should be there at the time of installation. Next part is the appropriate training of nursing staff and the technical operators. And believe me, this is the most important thing for their safety, for the safety of machine, for the prolonged life of machine, and the appropriate diagnosis or the treatment of the patient. So the training part is important. Next thing is the PMS part, the preventive and maintenance of that particular equipment which we are using. Regular maintenance of the equipment should happen with the knowledge and awareness of the technical staff and nursing staff, so that they can be safe from all the mishappenings which could happen because of that thing. And appropriate time of condemnation of that particular equipment should be defined, because if we don't, we keep it using for a longer time, it may be harm for the nursing staff or the technical people or the patient also they are using. So for the patient safety, these things are important. The equipment, its maintenance, its management, the people who are getting it should be properly trained about it. They should know what if something happens, what to do, like fire drills and everything. And eventually, awareness of the patient about the treatment also he is going through. So these are the things we are doing to prevent to have the safety of the patient and to have the safety of the nursing staff or the technical people involving in a particular equipment.
Yeah,
My
there are emergency monitoring systems are there with the alarming sound. latest.
Yes,
I
yes,
think
yes.
we, yeah,
These are on the site.
these
These
are
are
the
on the site.
things are there. Thank you, Dr. Saurabh, and thank you, Colonel Malti, ma'am. I think anything else you would like to add?
Yeah, actually, what I meant was, I'll give you a simple example. Transporting a patient, lifting a patient, the things which we use are still the older methods, because the new equipments are very expensive. Any new things have come up in these areas which can help the nurses be more comfortable.
This is
Some
a suggestion, I
internet
guess.
issue. Yes, some internet issue is there from my sides.
Hello, can you hear
Yeah,
me?
ma'am.
This is a
Yeah,
suggestion.
ma'am.
I guess
Please continue.
from Malti ma'am said this is a suggestion for us, I guess. The transportation of patients should be better. It should be more safe for both the care provider and the patients, ma'am.
Yeah, but the systems which are there for good transportation are very expensive. Okay, and it only
Yes, ma'am.
adds
Yes.
stress of the patient in their financial requirements. Okay, so anything which we have done which can be of improvement in helping the nurses, nothing as yet.
Nothing has yet, but only proper training of the staff. This is the only thing, ma'am, because India is again the
Doesn't
developing system is there.
leave
We
of
are
this
working on.
during transportation. So that's one place where I think we should really pay attention to in devising methods or
Okay.
equipment. Okay. And second is nursing records, digital nursing records. What has been done?
Ma'am, for nursing records, the things are under process. For
Okay.
up to this time, we had this handwritten records. For the older records, also we are digitalizing them. But for the future, for nursing records, for every nursing records, we have to manage the system. Or HIS is not capturing it till now. Future will be having a
So
scope of
I
this
have
thing
some
also.
experience on this. So that's why I was asking you on this.
Yes, yes. This is the point we are working on, because the work of a nurse is so exhaustive. Everything to digitalize everything, it will take long time. So we are planning it out. How can it could be shortened easily?
If I could be of help, then I would
Sure,
definitely
ma'am. Sure.
like to guide you on this.
Definitely,
Okay.
definitely.
Thank you, ma'am. Thank you, ma'am. Mantu.
Thank
And
you.
now yes, ma'am. Now I hand over to Professor Amli to conclude the session. And from my core of the heart, I'm thankful to all the panelists and even the participants for keeping this session enriched and with full of positive energy, with having one aim, let all patients are safe and happy. Thank you. Over to Professor Amli, please.
Good afternoon, everyone. On behalf of this event, I extend my sincere gratitude to each one of the panelist members. It has been an enlightening and engaging session, and we hope it all the valuable contributions to all our esteemed panelists. Firstly, I'd like to express the heartfelt appreciation of our distinguished panelists for sharing their profound insights, expertise, and experience on the topic. Your perspectives have not only broadened our understanding, but also inspired to deliver deeper into the subject matter. We also immensely gratefully to our National ANI President, Captain Ajita ma'am, and also organizing and Vice President, Dr. Unmano ma'am, for this ensuring and every voice was heard and every viewpoint was considered. Your skillful moderation had enriched the discourse and kept us all captivated throughout the session. I would like to extend our gratitude to the audience members for their active participation, thought-provoking questions, and enthusiastic engagement. Your presence has truly elevated the energy of this event. It is a memorable and rewarding experience for everyone involved. But last but not least, a big thank you for the organizing committee, volunteers, and technical support who involved in this talk show and made a success. As we conclude, let us carry out the insight gained today and continue our collective journey towards a greater understanding, knowledge, and collaboration. Thank you for all our esteemed panelist, moderator, audience, the organizer committee, and wish you a success in your future endeavors. Thank you, ma'am.
Thank you, Madam Geeta.
Yes, ma'am.
Yeah, it was a very fantastic session, I can say. Yes, of course, we could have expect more participant. However, it is whatever you all done, it is absolutely very fantastic. And also so many questions came up. I'm very happy for it. And we have to ensure that next Empower Hour, many of the participants can join. Madam Ajita is here. Madam
Captain
Ajita.
Ajita.